Welcome everyone to this webinar on fertility and intimacy challenges in survivorship care.
I can definitely sense also the emotional side already of this topic in the words that come up. Any culture said is a very taboo topic or feels uncomfortable. So, return to work. Impact on your body relation, disabilities.
And especially in the higher dose range, I think So if these in my blue circle are the most important treatments. So that's radiotherapy to the ovaries, especially above 10 gray, and that's the alkylating agents. And the alkylating agents, I will explain later what they are, but we don't see under 6 milligram per square meter, we don't see the risk of fertility problems is low. So just some practical tips. To know your precise treatment is really important because that is basically what will inform us about your risk. And the other thing that's also very important is that the general population, 1 in 10 people have fertility problems as well. So it's also common in the normal population. And the other very important positive message is that most survivors will fulfill their desire for children. And please talk to other people, talk with other people about your doubts or questions or whatever you have.
From your follicle pool, your ovarian reserve is stored in the outer lining of your ovary, so in the little white line on the outside of the ovary. And from that group of what we call dormant egg, your ovary recruits a group of small eggs that it selects to mature, and from that group you will choose 1 egg for ovulation. This is very different. Boys have testes, and those testes, I would explain, the most simple way to explain, are little fabrics, and they produce sperm. So those can be damaged as well by treatment, but if the fabrics or the testes and is not harmed too much, they will keep producing sperm, and the numbers between males and females are very different.
3 important aspects. Your feelings are very important, your relationship, and also medical uncertainties. Your feelings we have talked about, for example, tired or sad or uncertain about yourself. That does not help. So you need to recognize your own feelings, and you need to recognize what is going on in your relationship.
I think that healthcare providers should also have a guiding role to help survivors think about these questions, so that is not only dependent on the survivor itself. Of course, survivors are also encouraged to ask these questions, but I think there's also a role of the healthcare professional in this.
I think it's so important that we practice the same as we preach to our survivors. We also should ask our survivors, can I talk about this? What are the words I can use? You cannot use every word for everybody, so ask the survivor. I think I want to say something on intimacy and sexuality, but is that also what you want? And please help me use the words.